Atracurium is a medication that was developed in an attempt to produce a short-acting muscle relaxant that would be independent of liver and kidney metabolism. Atracurium is used for muscle relaxation to facilitate surgical procedures and tracheal intubation. It is short-acting and independent of liver and kidney for termination of its action. It works by blocking two subunits of the nicotinic M receptor site by competing with acetylcholine. Acetylcholine is a neurotransmitter that is released into the neuromuscular junction in order to cause skeletal muscle contraction. Non-depolarizing relaxants can also block pre-junctional sodium channels, and as a result, they interfere with the release of acetylcholine at the nerve ending, also preventing muscle contraction. This is a demonstration of the normal depolarization of the nicotinic M receptor, which leads to muscle contraction. Two acetylcholine neurotransmitter molecules are released and bind to the alpha subunits of the nicotinic acetylcholine receptors on the motor end plate of a muscle cell. This induces a conformational change of the receptor, causing it to open and allow free exchange of cations across the membrane, specifically sodium in and potassium out. The amount of sodium that enters the cell is greater than the amount of potassium that leaves, causing depolarization and ultimately the generation and propagation of an action potential along the T-tubules in the muscle fiber. As a result, calcium is released inside the cell. This increased concentration of calcium inside the cell allows muscle excitation coupling to occur. The non-depolarizing muscle relaxant Atracurium works by blocking two subunits of the nicotinic M receptor site by competing with acetylcholine, which is the neurotransmitter released into the neuromuscular junction in order to cause skeletal muscle contraction. As you can see, there is no free exchange of cations, therefore no muscle contraction occurs. Atracurium is supplied in an IV formulation with a concentration of 2 milligrams per milliliters. The ED95 is 0.2 milligrams per kilogram with an onset of 2 to 4 minutes. The peak is considered the time until the train of 4 equals 0, which is shortly after the onset, and the duration is 30 to 60 minutes. Atracurium is metabolized by both the Hoffman reaction, which is non-enzymatic degradation at normal body temperature and pH, as well as ester hydrolysis to several compounds, including laudanosine, which is a potentially neurotoxic metabolite if allowed to accumulate in significant amounts. The hydrolysis is catalyzed by non-specific esterases, not acetylcholinesterase or pseudocholinesterase. Less than 10% of atracurium is excreted unchanged by renal and biliary routes. Laudanosine, a tertiary amine, is a breakdown product of atracurium elimination and has been associated with central nervous system excitation, resulting in the precipitation of seizures in patients with an extremely high total dose of the medication or hepatic failure, because laudanosine is metabolized by the liver. Because of its unique metabolism, atracurium's duration of action can be prolonged by hypothermia and to a lesser extent by acidosis. Atracurium has been known to induce histamine release. Histamine can decrease blood pressure and cause reflexive tachycardia. It produces an active metabolite, laudanosine, which is a CNS stimulant and in theory could increase the percentage of volatile agent required to achieve 1 MAC, a measure of anesthesia. The duration of clinical action of one ED95 is 20 minutes, or 1 twitch observed with a nerve stimulator. However, mechanical ventilation is required until the drug is entirely removed from the body, which is 80 to 90 minutes, or until the patient has received an appropriate dose of anticholinesterase reversal agent. This medication is a good option for muscle relaxation in patients with hepatic or renal pathology. Here are some links provided for more information about atracurium. And finally, these were the resources used in the production of this presentation. Thank you very much.